There is no need to be perfect to inspire others. Let others get inspired by how you do your imperfections. Hello, it's your girl Olori, and I'm here with the formidable Dr. Adesanya, a renowned gynecologist and obstetrician, a promoter of good living and good health. You're welcome, Dr. Adesanya.
Thank you very much, Olori Giwa. Thank you for having me yet again.
Okay, so we are here again, and I'm bringing to the audience today a very, very spectacular, not funny, but really serious topic in women. Today we're talking about vagina odor, vagina infection, vagina discharge. So over to you, Dr. Desanya. What is vagina discharge?
Well, as the terminology implies, is a discharge that is coming from the vagina. Yes, that's what we see. But what's the source of this discharge? It can be from the lining of the vagina. It can also be, you can have some contribution from the cervix or cervical mucus. So, in a simple form, vaginal discharge are liquid discharge that comes from the vagina. It's as simple as that.
Okay. So this vaginal discharge, I know we have different colors. I know some come in whitish, some are yellowish, some are kind of brownish. So what's a healthy vaginal discharge?
All right, thank you very much for the question. There are characteristics of normal vaginal discharge. So vaginal discharge is expected to be very minimal, clear like water. You should not have, vaginal discharge should not have a particular color. It should be clear like water. Then it should also be odorless. There should be no odor and minimal in quantity. So these are the characteristics of vaginal discharge that is normal. Now, it becomes abnormal if any of these characteristics changes. For instance, clear like water, even when it becomes white or whitish, it's calling your attention to something. It becomes brownish. You need to check, why is it brown? If there is any ascribed color to vaginal discharge, then it becomes abnormal. That's one. Two, you are very conversant with a particular volume. It's very minimal, scanty. It doesn't really stay in your panties, or you just use panty liner once in a while. Then it becomes heavy, voluminous. Then it's calling your attention to something. What's bringing this up? Because it's no longer normal. Then the third characteristics we talk about is odor. It's supposed to be odorless. By the time you start saying it smells like, then it's abnormal. I don't know if you're.
Yes, I do, but I still have some other questions that I need to ask you pertaining to the vaginal odor. So when we're talking about vaginal odor, I know normally, by my own understanding, as a woman, after wearing our panties, our underwear, and our trouser pants and all of that, going about maybe after 2-3 hours, is it normal for that area to have a particular scent? Not necessarily bad, but it can't be fresh all day. Does it have to be fresh all day?
So effort should be made towards ensuring that it's fresh all day.
How so?
So that's why we sometimes use the terminology, allow your vagina to breathe. So there are certain particular types of clothing that you're supposed to avoid. Right. The nylons and all the likes. So that do not encourage so much heat around that place. I mean the nylons or the kind of clothing that encourage heat there will encourage some changes in that area that encourages vaginal discharge and odor. So effort, yes, it might be very difficult. That's why you pay attention and you make conscious efforts to ensure that the place is always dry. There is aeration. You don't you don't allow foreign or objects around the place. Those are the things that encourage or that may cause vaginal discharge.
I was coming to that,
Okay.
but all that touch right there, Dr. Ismaya. So the next question I want to ask you is, what particular underwear fabric would you recommend to women?
So it's simple and straight. Avoid the nylon. I mean, if you're using any, let it be cotton. Let it be cotton. That's most recommended.
Okay,
but so at the same time, if you can, this may sound funny,
okay,
especially at night. There's no reason why you're wearing and tighten everywhere up. Just have a shower, ensure everywhere is dry, allow aeration. So
so ladies, women, girls, we heard from Dr. Isaya. Yeah, he said at night, be cool, make an alarm, breathe, let that place breathe. So I mean, right?
Yeah, absolutely.
Let it breathe. I think I agree with that.
Okay, let it breathe.
Yeah. So he's saying the recommended fabric, underwear fabric that ladies should wear or must wear to have a healthy vagina should be cotton. Maybe cotton panties, cotton tights, cotton G-strings, cotton butterflies, as the case may be. So everything should be cotton to have a free and healthy vagina. Okay, so the next question that I'm going to ask is, how do we treat vagina? Or before I go there, what is vagina infection? What are the different types of vaginal infections? Because there's this common knowledge of toilet infection. I don't know. Is anything like toilet infection? Or we just disguise whatever infection like the yeast and the fungi as toilet? Everything is toilet infection to a lot of women.
Okay, so I think the terminology toilet infection is more acceptable to the general populace.
Right.
Everybody. Well, I want to believe it's regarded as toilet infection because it has something to do with the toilet, going to the toilet. Note, it's not only women that have toilet infection, guys too have toilet infection. Because when there are some condition that is when you're in the toilet that you feel the symptoms. Maybe that's why. So there are clear diagnoses, in our medical world, there's no diagnosis we tag as toilet infection.
Okay.
But there are conditions that when you have urinary tract infection now, when you want to wee and you are feeling so much pain, or you are going too frequent to the toilet.
Right.
If you target toilet infection, it's not out of place. But not generalizing everything as toilet. Well, maybe if it's acceptable, but the most important thing is not to trivialize any symptoms you have and assume, okay, it's just toilet infection. Now, when you ask about the different types of vaginal infection, that's a very broad topic that may, like I said, when you see anything that is different, that's away from the normal traits that are earlier elaborated.
So what are the signs?
Signs.
How do we know we have toilet infection apart from maybe sensational feeling?
No, they're bringing toilet infection in now. So there is toilet infection that.
Oh, did I say toilet infection?
Yes.
Sorry, vagina infection.
Okay,
the vagina infection.
Vagina infection. So there are quite a number of symptoms. That's what I've already mentioned some of them. Increase in vaginal discharge in terms of volume,
right?
Change in color,
right?
Different color. You can have different color that signifies different types of infection. So, and you can also have it coming with odor. In fact, there are characteristics odor of some certain infection. Also, for instance, bacterial vaginosis. Like that's why I said I don't want to use all those big.
No, please go ahead, feel free, and give us a summary.
When you notice that you're having discharge that is coming with fishy odor.
Okay.
It smells like rotten fish or fish. You don't sit on it. I mean, at this point, I think it's more important to talk about our attitude when we have any form of vaginal discharge because of the possible attending complication if you don't manage it properly. So those are just at times you can have some hotness, some dryness. It can come in form. You can have vaginitis. It can come in different form, cervicitis. But classically, what they present with is that increase in discharge, or at times itchiness around the vulva, around the vagina. Then this discharge that comes with odor, that's showing some color. Then also, when you start having sex and you are having pain, it can also be a sign of vaginal infection that is progressing if you don't manage it properly. So there's quite a number of other things that may come up if you have vaginal infection that's not properly treated.
Okay. So I think you've answered all of my questions, but I'll still ask this anyway. How do you differentiate an infected discharge from a healthy discharge?
That's the same thing we are talking about.
Right. I know, that's why I said
it's almost like the answer of normal and the abnormal. Do you understand? So we're bringing this question. So I think it's just straight. It's either you have a normal vaginal discharge or you're having abnormal. And when we say abnormal, yes, abnormal may not necessarily be from infection, because if you have a foreign body in your private part that is maybe for whatever reason, there will be an increase in vaginal discharge. Yes, that's abnormal, but not necessarily infected yet. But just note that will definitely become infected if not attended to properly.
Okay.
Do you understand? So I don't know if that answers the question.
Yes, it does. Okay, so on to the next question. What are the causes of vaginal infection?
Okay.
How do women and men get gets infected? I can't say. So so in the case of the men, what do we say?
Men contribute to vaginal infection.
No, that's what I'm asking.
What are you asking?
For women, in the case of a woman, it's vaginal
discharge.
In the case of a woman, it's vaginal discharge. So in the case of a man, it is called what?
So you can have urethral discharge.
Please, let's be. I think that's just too nice. Just vaginal discharge. In the case of a man,
what is it called?
Yes,
it's urethral. It can be urethral discharge too.
Not a penis discharge.
No, there is no space. The only space you have there is the urethra. Like for instance, now you can have urethral discharge in a woman.
Because I know some men leak. That's why I'm asking this question.
Leak what?
Some men leak.
How do you mean leak?
Like they leak from that tiny hole. Some men leak. Is that a sign of infection?
So, absolutely, that might be a sign of urethritis. It's a form of infection.
That's what I'm going to.
You have some particular.
So it's not normal.
It's not normal. Yes.
It's not normal.
It's not normal. You're not supposed to.
Sometimes before sex. Sometimes not even during sex.
Now, relax. When there is something coming out before sex, it may be as a result of sexual excitement.
Okay.
It may be as a result of early ejaculation.
Okay.
Or something coming from the prostate prior to sex.
Okay.
That may not necessarily.
That's a different thing entirely.
That may not mean.
But when not in a sensual
you
mood,
have a pulse discharge or anything that is coming with color or blood.
Pus.
Yes, pus. That's why I said pus.
Okay.
Or blood. Then the guy needs to quickly go and take care of himself.
Right.
And one of those things that I like to emphasize that we don't really talk about is all these things. Once a guy sees that, do you remember what we did during COVID? When someone has COVID, you look around, how many people were around him or her around that time? You want to screen and test all of them. That's what we call contact tracing. If a man has urethritis as a result of either chlamydia infection or gonorrhea infection, that man should screen every. Is he supposed to sleep with more than one So every sexual partner, so to speak. And you're supposed to do what we call contact tracing because of how dangerous that can be. If you see, one of the causes of infertility in our environment now is when you have a patient who has PID, maybe as a result of infection with gonorrhea or chlamydia. If you don't do contact tracing and treat all of them, it continues to move around.
I think we deviated a little bit from the question.
You brought us here.
Yes, I know.
Okay.
So what are the causes of infection? So I think you just mentioned, if you want to recap.
So causes of infection, it can be causes of infection.
Vaginal infection.
So,
or infection in a man and a woman.
It's
in that area, in that axis.
And straight. When you have, for instance, you are bringing man in, you're already answering the question.
Okay.
When you have infection in man and woman, it's usually sexual.
Okay.
It's usually sexual, but there are other things that can come from vaginal
discharge
or vaginal infection. Foreign body, the use of tampon are not properly used, with good hygiene.
Good.
Or maybe your menstrual hygiene.
Good. And
then there's other things. Even when you have your immune system is not properly built, like you have low. I mean, your
diet.
Your diet. There are some medical conditions too that can drop your immunity and predispose you to having vaginal infection or discharge. There are some habits, some lifestyle decision. For instance, you that you're trying to be clean, douching that area, because that place is designed to manage the environment, the ecosystem by itself. That place is naturally occupied by some organisms. Those organisms are like, the oddly, the cleaner, they're the one maintaining the ecosystem of the vagina.
Okay.
So when you have intercourse and you are not comfortable, you now try to be clean, you now try to be extra, you are washing or trying to clean that place. Indirectly, you're washing away those organisms that maintain the ecosystem.
To protect.
So that protect the ecosystem. So if you now wash them off, the strangers will now have ground
to flex.
And they now, thrive and, bring up all these different types of infection. So there are habits that occur. Then, above all, men are regarded as silent, what do you call them now? Silent carrier. When it comes to infection, they may not even manifest symptoms, but when you have sex, a carrier has sex with a woman, you can have vaginal infection, you can have vaginal discharge.
Okay.
That is why we talk about contact tracing. Do you understand? If a woman, even if it's a lady that is having a discharge and you made a diagnosis and you're suspecting chlamydia or gonorrhea, those are the most deadly. There are other ones. Deadly, well, I use the word quote and unquote because of the complication that comes with it. So you must do contact tracing. Even if the guy is yet to manifest symptoms, you try and treat them. Because when you treat the lady gets better. The guy is a silent carrier. You don't treat the guy. Once he gets better, they come back again. There will be reinfection.
Okay. Just so we are clear, I'd like to ask this question again. Who is faster to show sign of an infection in that area? The man or the woman? Because there's a misunderstanding about all of this, that the man doesn't really show, is the woman that quickly shows and all of that. So who is faster to show sign of all of this?
If you want a straight answer, it's definitely the lady.
The lady. So
if you want a straight answer, now the explanation, may take us to another level, but the straight answer is the woman for various reasons. There is a connection between the inside and outside for the woman, and a lot of things are designed to maintain that thing. Right. And remember, a lady brings out some stuffs every cycle, every month. Not even only during period. During ovulation, remember one of the things that make some people, that help some people mark their ovulation period is some subtle increase in discharge during the ovulation period. So that place, there is a rapid rate of proliferation in the genitalia, in the female.
Sorry, does it necessarily have to come with an odor?
No.
Okay.
No.
That was just a quick question.
That is why we are explaining.
Not necessarily a bad odor.
Well, bad odor, naturally, during when we're talking about menstruation, there are some people that naturally have some peculiar scent. Do you understand? So even their sweat, but that is not supposed to be. It's not supposed to be a bad odor,
right?
But by the time it becomes significant that you yourself, you are seeing smelling.
You're perceiving yourself.
You're perceiving, or someone is perceiving. Then it's no longer.
It's not normal.
A normal stuff.
Okay. Thank you very much, Dr. Desonya. I think you've been able to clear the hair on, to an extent, on vaginal infection / vaginal odor. So what advice do you have to the women, most especially? Because I know we still have lots of women that still suffer this, and we still carry this around, probably because we are shy, or we don't know who to talk to, or we don't know where to go to. So I'm saying it today that it's not really a big deal. It's not really something to be afraid of, or I don't think anybody should stigmatize anybody for vagina, because we're all women. And then, just before I conclude, I was going to ask this question. So some time ago, my friends and I were talking about something like this, and then I had some of my friends say, I've never had vaginal infection in my entire life. And I thought to myself, that is not true. Can there be any woman that hasn't gotten, or that hasn't been infected in any way through the vagina, or have had vaginal infection?
Absolutely, yes.
It's possible.
What is impossible is for a woman to say, I've never had vaginal discharge. But I've never had vaginal infection. It's possible.
How so?
If you maintain hygiene from day one, you keep the place.
Okay, so
you know how to manage the ecosystem.
That question is very tricky. Because now I'm asking about this as a young girl. A young girl from secondary school, a young girl in the university. You're in university, you're sharing toilets with people, you're sharing all sorts of things with people. So are you telling me that at some point she wouldn't have had something? So even if it wasn't bad.
So we are saying the same thing. We're saying the same thing. Sharing toilet, because of the word toilet infection, doesn't give you vaginal discharge.
Okay.
Now the question is, how hygienic? How do you manage your hygiene? So if you don't manage it well and you get infected, yes, you have infection.
Right.
But is it possible to manage it so much so that you don't get infected? Yes, that's why one of the questions you asked before is, what is the best time for a lady to actually consult with a gynecologist? As early as you can, so that you will be well informed, that you will be well schooled about your system and how to manage and maintain some level of hygiene.
It's not a thing to be ashamed of.
Absolutely. That's one of those things you mentioned that gladdens my heart. See, it's unfortunate that symptoms around that genital, our private part, we don't come out easily to talk about it. And most diseases, there is this general saying that a problem once identified is solved. Most diseases linger on when you don't address them on time. When you delay your presentation, when you delay your intervention, then it becomes a big deal. So you should make friends with your gynecologist. You should be close to your gynecologist as early as possible. I used to say this. I read Every Woman as a secondary. I didn't even know I was going to become a doctor. When I read the whole book called Every Woman, I realized that it taught a woman from head to toe what to expect, what to do when you see this and all of that. And even when you are pregnant and when you are in labor. So I didn't know what, I mean, it wasn't even my book, it was a friend, and I picked it. I don't know, maybe that's why I became a gynecology. I don't know. So every lady, every young lady there, teenagers should be taught menstrual hygiene, what to expect, how to manage, how to keep the place clean.
Tidy, clean.
So that is my message for the mothers. And this one, I won't be very glad with myself if I don't say this. The populace, the masses should change their attitude towards certain symptoms. One of them is vaginal discharge. What is most common in our environment is once a young ladies have a vaginal discharge now, they walk
stigmatized.
No, not necessarily. We're not talking about stigma now. Because of the fact that she's scared of stigma, she doesn't consult, she doesn't talk to anybody. She walks to the chemist, roadside drug,
sellers,
over the counter, or you call them chemists or pharmacists. Some pharmacists, I don't know, will not even hesitate. They are supposed to hesitate. You don't just go to pharmacy, I have this, I want to buy this without prescription. Without prescription. So the reason is once they buy antibiotics, we have over 1,000 different types of antibiotics. Once you buy an antibiotic or you combine them and you use them and you feel dry, you think the storm is over. More often than not, it's not over. There is an entity called ascending infection. If you don't have adequate clearance of that infected organism,
it will cause.
Then it gives room for them to multiply again. Then you have an infection. Apart from that, it ascends to the upper or to the internal genitalia. This is what defines, this is one of the things that define a woman because of fertility. And there are friable structures there that if any of these organisms ascend and disturb them, then that kind of person will struggle to conceive, to get pregnant. So don't trivialize any form of vaginal discharge or any form of vaginal symptoms you see. Consult on time, check on time, and address it on time, and get back to normal like nothing happened. I mean, that is the most important thing I would like everybody to take home from this discussion.
Okay, thank you. So there you have it, audience. If you're still confused or if you still have questions that you want to ask the doctor, please drop your comments, ask your questions, drop some suggestions on the address on the screen.
It's just a gist with the gynecologist.
Thank you very much. Stay safe.